Welcome to our next podcast for the International Journal of Diabetes in Developing Countries, IJDDC, the official journal of RSSDI. And it gives me immense pleasure to share with you that we have none other than our editor-in-chief, Dr. Rajiv Chawla, sir, who is here to talk about the next online edition. So I hope you all have been logging in using your membership number and the password, going through the RSSDI website and checking out all the important articles in the IJDDC. That is such a huge scientific resource for all of us. Without much ado, let me welcome Sir and
Thank you,
welcome.
Dr.
Good evening,
Purvi.
sir.
Yeah. Thank you, Dr. Purvi. Yeah.
So we are so excited to talk about this new edition that's coming up after the thematic edition on diabetes and pregnancy, which was extremely useful to all of us. And the discussion around it was also very insightful. I request that we talk about the new edition today.
Yeah.
And I noticed when I was going through the articles that are in there, I noticed that you really selected a variety of articles, case study, as well as the original article. And the editorial specifically caught my eye. Uh, it's focused on advancements and insights on diabetic retinopathy, nephropathy. So I really wanted to ask you, why the focus on diabetic nephropathy versus any other topic that is being discussed today in our field?
Yeah. Thank you, Dr. Purvi, for setting the context. And you very rightly said that the October, November, December issue of IJDDC, which is going to be online this week itself, it has very wonderful manuscripts are related to diabetic nephropathy. Earlier editorial also, if you see, I have been trying to touch upon the clinical topics, although our journal caters to basic manuscripts also and the original articles also. But I have always made it a point that we try to touch upon something which is relevant to all the clinician practicing across the country. And in this issue, we found that there were at least 5 to 6 manuscripts which were related to diabetic nephropathy. What really interested me was that today we know that diabetic nephropathy remains one of the very critical comorbidity or complication in setting of both type 1 and type 2 diabetes. And of late, there have been a lot of new multi-dimensional thinking about diabetic nephropathy, whether it talks about the pathophysiology, the prediction of diabetic nephropathy, as far as early checking the course or halting the course of natural course of diabetic nephropathy in patients with type 1 and type 2 diabetes. There are various biomarkers which are available and new treatment strategies. So I thought that in the earlier issue we touched upon MASLD, we talked about diabetic retinopathy, we also talked about peripheral neuropathy. So it really interested me when I was going through the TOC of this issue that we must take up diabetic nephropathy, a very, very common condition in the setting of type 2 diabetes. And today we understand that close to one third to about 50% of patients in their lifetime will end up with diabetic nephropathy or end-stage renal disease. So we thought that this time we talk about more of diabetic nephropathy. Of course, issue has many more new articles which we'll be shortly discussing.
Absolutely, sir. You really hit the nail hard. And besides, I think a lot of emphasis is also on overweight, obesity, which is becoming a huge problem in a country like India also. And I think diabetic nephropathy is, it's just an extension of that as well. So I think it's a very timely issue, and I'm glad that there are so many advancements coming up in diabetic nephropathy. In fact, it's very different from the way we learned in college or medical school, as to how to treat it. So, yes, I'm really looking forward to our discussion and more so the journal um, articles as well. Sir, so before we go on to the advancements in management, um, I would really request you to throw some light upon the inflammatory markers and the genetic influences that we have stumbled upon in terms of the pathophysiological understanding of diabetic nephropathy.
Very true. You very rightly said. Before we go to talk about the treatment strategies and your insights into how we address diabetic nephropathy in type 2 diabetes, I think of late we have had lot many biomarkers which are now available. In fact, in the current issue only, we had a very good article which is getting published, which talks about, it is by Christopher, which talks about the inflammatory markers which are going to be extremely important. Early days we knew about TNF alpha is very important marker. Now we know that interferon gamma in patient with diabetic nephropathy, it has a very direct relationship with ACR also. And if these markers are there and these inflammatory markers are on the higher side, that can predict the course of diabetic nephropathy in these patients, because it possibly very positively correlates with ACR and negatively correlates with the reduction in EGFR. So if markers like interferon are positive, interferon gamma or TNF alpha are positive in patient with early diabetic nephropathy, that gives us an insight that these patients are the one who are likely to worsen. So these are very important markers. You also said that of late we are hearing about genetic influences on course of diabetic nephropathy. Early days also we knew that there is always a clustering of risk factor in certain families. It is not that every type 1 or type 2 diabetes patient whosoever has poor glycemic control will end up with diabetic nephropathy. Rather, there is more clustering in the family. There are certain families which are more predisposed to get diabetic nephropathy, and that too, it happens very rapidly. So, of late, we have been talking about cytokine gene polymorphism, which again tells us that if it is positive, it is likely that these patients are at a greater risk for developing diabetic nephropathy, and course may be little faster as compared to someone who is negative for cytokine gene polymorphism. Of late, we are also talking about pentraxin, which is PTX3, which is again a very important genetic marker, which talks about that if it is there, these patients are at a greater risk for progression of diabetic nephropathy. And this manuscript is also getting published. That is why we picked up this topic, that this actually highlights that if you have these genetic markers, they can influence the course of diabetic nephropathy in these patients.
This is so fantastic, so very unraveling. And I think in the times to come, there will be probably this will encourage more and more researchers from India to actually take it up and look into it so that we can actually establish these markers as they have great predictive value on the disease course. So thank you for that information. I think so far we always looked at these inflammatory markers as non-specific inflammatory markers, but this association with ACR really changes our perspective. And of course, the genetic influence, we always notice that certain families have, then there is also a lot of anxiety on the clinical aspect. Patients do come saying, my mother died of this kidney disease, or, my father had this. But they are not wrong in certain ways, because today we are even hitting upon that there are genetic
True.
influences that
Very true.
go into it. So as far as the pathological lesions and the clinical implications of diabetic nephropathy, so what is the latest that we are learning in this aspect of diabetic nephropathy?
Yeah, again, sharing with you, there is one another very good manuscript which is published in the current issue by Ellie Can, which talks about a relationship between diabetic retinopathy and the renal lesions. Because if you have presence of diabetic retinopathy, it is possibly that these patients are more likely to have glomerular as well as arterial lesions than the interstitial lesions. So if these lesions are there, they can again be predictive of the course of the disease. And earlier, sharing with you, we had one very good publication in primary care diabetes by our own group. It was a study led by Shubha Chawla et al., where we had tried to establish a link between diabetic retinopathy, microalbuminuria, lipid profile, BMI, and we talk about these modifiable risk which could predict the course of nephropathy in these patients and having a direct relationship with diabetic retinopathy. And there is another one study which I again might cite here, although it is not published in the current journal, but it was published in JOD by our group, where we talk about renal cortical thickness, which is a very, very early predictor of progression of diabetic nephropathy. It can actually come much earlier than overall length, bilateral renal length, and it can be a better predictor of course of diabetic nephropathy. In one of our studies, which we presented at ACE last year, we also talked about renal resistive index, which is a index predicted on renal Doppler, which again can be a non-invasive marker for prediction of diabetic nephropathy. So today we have many markers, both biochemical, genetic markers, which can influence the course of diabetic nephropathy. And these markers in the clinical practice can give you sort of precision medicine. Who are the patients who are at a greater risk for having early onset of diabetic nephropathy, and where it is going to progress much faster as compared to the other group. In many studies, we have found that progression may not be very, very fast. So, all these studies are published in this issue of IJDDC October to December issue, and I'm sure it is going to interest everyone. So, it will be wonderful having all the membership to log in into IJDDC so that they can benefit from these manuscripts. Other than diabetic nephropathy, in this issue, we also have a wonderful study by Dr. Mohan's group, led by Dr. Anjana, which is again talking about overall comorbidities and prevalence of complication in setting of type 2 diabetes, and what is going to be the epidemiological course, and how these are going to influence our approach towards management of type 2 diabetes. There is another one very good manuscript on type 1 diabetes. This may interest all young diabetologists, those who are into technology. Many we know, including your own group, Dr. Purvi, that you people are doing a lot of AGPs and CGMS. And in this, they have what they have done is they have tried to establish a link between TIR, getting a better TIR if you are using CGMS regularly in a case cohort study, which is also very, very interesting. So there are many good manuscripts which are getting published in October to December issue of International Journal of Diabetes in Developing Countries. So this podcast is primarily aimed to invite you to log in into your own link once it gets online in a week's time, and try to benefit from these manuscripts. And I'm sure it is going to be a wonderful experience if you go through the TOC and try to get these studies and get some insight from these international publications into this issue.
Sure, sir. I can't wait to get my hands on to that. I think I realized that it's across the spectrum of diabetes care physicians itself that this online issue is going to be so interesting. So before I let you go, just one last aspect, if you could address the impact on, or is there any impact of nutrition and also physical function on diabetic nephropathy?
I think that is also a very good point of discussion, because in this journal, this issue of IJDDC, again, we have a very good manuscript. Early days, we were talking of protein restriction. We knew that if you can restrict oral protein to 1 gram per kg per day basis, that may check the progression of diabetic nephropathy in these patients. But contrary to the belief, one study talks about, it is a Chinese study, which talks about, in fact, a relationship between those patients, those who are undergoing hemodialysis, and their nutritional intake, overall their protein intake, and the course of the disease. And it says that those patients, those who are little poor in nutrition, they are the one who are likely to have even poorer outcomes. And in terms of overall morbidity and mortality, that is also going to be higher if your overall diet intake or protein intake is less. So I think that sort of apprehension early days, especially when we are saying that we these patients should not be on very high protein. Contrary to that, especially those patients, Indian patients, those who are purely vegetarian, their total protein intake hardly happens to be up to 1 gram per kg per daily basis. Especially once they are on hemodialysis, they are encouraged to have high protein diet and a good balanced diet formula so as to avoid many comorbidities and high mortality in these patients. And they then tend to have a better muscle mass and a skeletal overall muscle strength if they are on a good nutrition diet.
And I think that is what actually eventually impacts the quality of life in these patients. So I think that's a great spectrum of articles and a whole lot of diverse aspects that have been covered here. A whole new perspective on diabetic nephropathy, and I think really salute to have gathered such fantastic articles for our very own audience. And mind you, all RSSDI members, please note this access is free for you. So do take advantage of this right from, learning about basic biomarkers to diagnostic challenges to looking at impact of food and physical activity as well as the newer management of diabetic nephropathy. This issue covers it all. So don't miss it. The articles are fantastic, one at a time, however you please. It's a great collection. And I congratulate Dr. Rajiv Chawla, sir, and his entire editorial team for putting up this wonderful edition together.
Thank
Uh,
you. Thank you, Dr.
thank
Purvi. You are all part of our editorial team, and I'm sure all our editorial team members, associate members, and even sub editors are doing wonderful job. It is always a teamwork. And one good thing I must share that now this journal being online, so a link comes every time you get a notification, even on emails, and from the link you can directly open it. And I must tell you, for the first time now it has been sort of presented like a book, so you can flip over the pages like you do in a physical copy or a hard copy. And I'm sure you will surely enjoy your International Journal of Diabetes in developing countries next issue. So thanks a lot.
Thank you so much, sir, for this wonderful podcast and information shared. And viewers, don't miss out on this wonderful edition.
Thank
Thank
you.
you again.
Thank you. Thank you.